Hello, today I'm going to talk about hypoplastic metatarsals. Definition: is a condition in which there is one or more abnormally short or overlapping toes metatarsals. This condition may result due to congenital defect or it may be an acquired condition. It most frequently involves the fourth metatarsal. Patients with this abnormality typically seek surgery because of cosmetic concerns, difficulty wearing shoes, or foot discomfort.
Some patients have a condition called brachymetatarsal. What that is a short toe deformity. But it's not the toe that's short, it's the metatarsal behind the toe that's short. So what happens is the metatarsal is short, the toe is short, and the toe doesn't fit into its normal parabola within the foot. The toe is typically apropulsive. The toe is unable to touch the ground. There's usually a cleft on the bottom of the foot. There's usually an overloading of the adjacent metatarsal bones. That short bone is not taking up its fair share of the weight. The weight is now being distributed to the other bones. So you get bursitis and uncomfortable situation with the other bones of the foot.
Application in medicine. It is directly related to premature fusion of the epiphyseal line of the distal end of the metatarsal. The etiology is unknown but is related to congenital causes, also to limbs affected by polio, familiar cases, Down syndrome and Turner syndrome, various osteodystrophies, and hypoparathyroid conditions. Brachymetatarsia can result from trauma or post-surgical associated with functional limitations and iatrogenic causes.
Cynthia Diaz is accustomed to keeping her feet under wraps, her toes especially.
People look down at my feet and be like, oh, what's wrong with their feet?
She was born with a foot deformity called brachymetatarsia. More common in females, it usually occurs when the fourth metatarsal bone doesn't fully form, resulting in a tiny toe that looks like it's growing on top of the foot.
It can cause the toe to look deformed, where you have a toe that's pulling up and back because the bone behind it is not long enough to support it.
The condition can lead to balance problems and foot issues. When Cynthia started experiencing pain wearing shoes, her parents sought help.
Then the more we investigated, the more it caused other health problems, and that's when we came and saw Dr. Ellis.
He offered a foot fix, sometimes called toe lengthening. Doctors actually break the toe bone, then attach this external fixator which pulls the bones apart, encouraging new growth.
And basically, you have two connections on either side of the bone. You cut the bone in between and you slowly stretch out the whole bone.
It doesn't happen overnight, but is amazingly fast.
Occurrence. There is no exactly epidemiological data available, but affects in the most cases exclusively women. Commonly found bilaterally in 70% of the cases, become visible between the age of 4 to 15 years old.
For millions of Americans, foot problems are a major cause of pain and disability.
Most of us don't think twice about our feet until we have problems, and those problems start affecting our daily lives. But for some people, foot deformities such as brachymetatarsia, that's a common condition where the foot is abnormally short and causes the appearance of a short toe. The pain, the embarrassment, and problems they endure are on a daily basis. Board-certified podiatric surgeon Dr. John Doolan of the Brachymetarsal Correction Center of New York tells us about treatments they offer to help their patients stay active and on their feet.
Brachymetarsal is a term that's used to define the length of the metatarsal. The metatarsal is the bone in the foot that is responsible for determining the length of the toe. So people who have this deformity have a short toe. It is caused by a congenital or a birth defect that starts around age 8 and fully develops around age 15. These people have a shortened toe, which can be painful.
Now let's find out about treatments.
There are two main treatments for this disorder. They're determined by the length of the metatarsal. If the metatarsal is not so short, we can use a bone graft with screws and plates. If the metatarsal is excessively short, we need to use an external fixation device and gently and slowly lengthen the bone.
Pros and cons. This condition causes disability for severe pain because the distribution of the body weight and thrust forced to perform each step during operation causes increased pressure on the anterior surface of the foot, which in these cases is abnormally low. Patients with these conditions usually seek for treatment because cosmetic concerns, difficulty wearing shoes, or showing their foot, which highlights symptoms of discomfort in their daily lives.
Diagnosis that he gave me is called brachial metatarsia. Basically, it's a shortening of my fourth toe. I actually had it on both of my feet.
This is a shortening of the bone, which means it didn't grow appropriate to its original length, and there's a growth plate disturbance. So this either happens with an injury to the foot as a child, or it can also happen as a birth defect. This short toe can create a lot of problems for patients. It can create bunny deformities, hammer toe deformities, because it changes the shape of the foot. As people age, it impacts them more and more as they go through their life.
It was mostly just rubbing up against the shoe. My balance as I got older was off.
The best time to correct it is when the foot is fully mature or that the growth plates are fully grown. This particular procedure that I perform is lengthening or growing of your own bone. You make a small little incision, and this incision creates a small break in the bone, and we apply external fixation device on the outside of the foot, and it allows the patient to turn slowly each day as I instruct to grow the bone.
Radiology. Findings include a short undeveloped metatarsal, at times with deficient bone content in general and with osteoporosis of the metatarsal head in particular. The toe is usually straight but in a extended position. Treatment. In cases, you can treat the symptoms by wearing wider shoes which relieves pressure from the toes, or you can wear padding around the toes. If there is pain and discomfort, surgery is occasionally indicated to realign the metatarsal head. In this procedure, the short metatarsal is cut and a piece of bone is grafted between the two ends by an external fixator attached to the metatarsal with pins. Within the external fixator, there is a screw that must be turned to lengthen the bone to the appropriate size with a duration of 2 to 3 months.
And we were able to tag along.
Okay, so this condition is called brachial metatarsia, and patients start noticing between 8 and 10. This is actually very common, but the reason we don't see it on other people is because they're hiding, just like you have. The good news is we can fix it for you. This is where the problem is. This bone is shorter, so in return, the toe stays back, and usually it kind of floats on the top. What we're going to do is put this small rail device that stays out of your skin, and it has 4 pins that go through the bone, and then we have to cut the bone in order for us to kind of stretch the bone. So we're going to be growing your own bone. You just turn an Allen wrench at home once or twice a day, stretching your bone about 0.5 millimeter a day. And once we're done and we take the device off, it would be as like you never had this condition.
Okay.
So we're going to fix both of these toes for you. I'm going to mark them. 1, 2. They're going to look different when you come out. Okay. The reason we're wearing lead is because I'm going to operate right under C-arm, which is light X-ray. So there's going to be a lot of radiation. We're going to insert 1 pin right here, another one right there, another one here, and this is where we're going to cut our bone. So we're drilling right into the bone. We're at the center of the bone right now, so that's exactly where we want to be. So this is the last pin, and after we're going to cut the bone completely through and through. If you listen carefully enough, you're going to hear the pitch change. 2 of them are moving, the other 2 are straight. That means we broke the bone. Once we start lengthening, the toe has a tendency to kind of stick up. So what I usually do, I wire the K-wire down and attach it to the external fixation. Now we're going to move on to the left foot. Okay, surgery is done. We're going from sad face to happy face.
Thanks for listening.